Hey guys, so today I am going to be talking about my algorithm for erectile dysfunction. If I kind of look to the side, it's because I have it pulled up. I still don't have a printer, but alrighty. So my topic today is going to be the treatment of erectile dysfunction. Just for some background info, erectile dysfunction is defined as a persistent or consistent inability to achieve or maintain a penile erection for sexual satisfaction, including sexual performance. Around 30 million men within the United States and 150 million men worldwide are affected by erectile dysfunction. The American Urological Association recognizes that treating ED, which I will refer to erectile dysfunction as from now on, heavily relies on the respect for the patients that are affected. So as we go through the algorithm, you'll kind of see that there isn't a specific treatment that all patients can go to. It's really dependent on the patient themselves and the conversations that they have with their physicians. And so, just for some pathophys, the cause of ED can be multifactorial, which makes it harder to treat. It can include vascular, psychogenic, neuronal, hormonal causes, and one of the big things that they've noticed is that there's a big association between CVD and erectile dysfunction. And so, when I get into the algorithm later, I'll kind of talk about how when they're assessing your underlying diseases and your risk factors, they will ask if you have any sort of cardiovascular disease. And then another big risk is diabetes. Diabetes is a major contributor to ED, and having uncontrolled diabetes can lead to vascular and nerve issues, which could exacerbate or put patients at a higher risk for experiencing ED. And one of the more common causes are usually vascular causes for ED. So, for diagnosis, men should have a medical, sexual, and psychosocial history, along with a physical examination and laboratory test to help eliminate certain risk factors or any underlying diseases. And then, if there are no other risk factors or causes, then ED is going to be diagnosed as a persistent failure to achieve a penile erection for at least 3 months or more. So if we look at the diagram, so I'm going to start with male patients who are already diagnosed with erectile dysfunction, meaning they've had failure for at least 3 months or longer. So the first thing we're going to do is consider any underlying diseases or risk factors that might not have been addressed before. Some things would be diabetes, hypertension, hyperlipidemia, are some of the common ones. You can also have spinal cord injuries, hypogonadism. All of these things should be looked at. And then some other things that should be looked at are some risk factors, such as are they smoking? Are they drinking? Are they taking any medications that might be contributing to these? And there are a big list of medications that can contribute to ED. And so it's important to take a look at these things before we start putting patients on certain medications or devices or invasive procedures that I'll talk about in a second. So if the patient does have any of these underlying diseases or risk factors, first thing we're going to want to do is treat those underlying diseases first, and then maybe try to remove any contributing medications or at least find alternatives if it's possible. There have been a lot of cardiac medications that have been associated with ED, and because ED happens in older men, it kind of comes along with it. And so sometimes it's really hard to just switch these medications, but it is important to kind of look at your medications to see if there are some things that could be contributing that you might not have to be on. And then treating your underlying disease, such as making sure your diabetes is under control, making sure you don't have hypogonadism, making sure your hypertension and hyperlipidemia, all these things are under control before we go on to specific medications for your ED. And then if they don't have any of these diseases or risk factors, the next thing we're going to do is try to determine an appropriate treatment. So for appropriate treatment, there are some phosphodiesterase 5 inhibitors that have been approved. These are going to be things like sildenafil, vardenafil, avanafil, and tadalafil. And each of these medications has their own set of adverse reactions that patients should look out for, and then they also have their own duration and onset. So it's very important that patients are talking to their physicians, trying to find which ones are the most appropriate for them. And so the guidelines had mentioned, and research has said that there isn't a specific treatment to start with first. Most men start with oral medications just because it's usually a little bit easier than invasive procedures or surgeries, but sometimes they can be expensive. Sildenafil or Viagra is no longer brand, so that might help, but usually these medications are expensive, but they're usually the first line just because it's a little bit easier than the other options. So that's why this algorithm is treated that way. But technically, depending on the patient, if they have a contraindication or they aren't comfortable with taking oral medications, they can go to something else. So if we go back to the algorithm, does your patient have a penile erection with a vacuum device or invasive procedure? So if we put them on a oral medication and it's effective, then we're going to continue on that method and then have a follow-up with their physician to make sure everything is going as planned. But if they are not, then we're going to try and have them on a vacuum device or invasive procedures. Some invasive procedures include intracavernosal or intraurethral alprostadil. It works on a different pathway. So if patients aren't responsive to PDE5 inhibitors, then maybe these invasive procedures might help them out some more. It's just common to note that it is more invasive, and most people don't see a lot of success rates at home, and more are seen when it's given in office. And so if your patient is seeing results on those, again, we would continue with that method and then have a follow-up with their physician to make sure they aren't experiencing any side effects, adverse reactions, and that they're getting the satisfaction that they're looking for. But if they are not getting that, then the next thing would be to consider a penile prosthesis. This is the most permanent. It's usually considered irreversible, and it's usually a last resort option just because it is so invasive and it's irreversible. And usually with older age, there might be other contributing factors that might not make it safe. So usually they would try the oral medications and then a vacuum device and then maybe the invasive procedures. But if none of those are working out, then it's something to talk about with their physician to see if a penile prosthesis is appropriate for them. So that's kind of the algorithm. Overall, patients should make sure that they are checked for any underlying diseases or risk factors that are common with erectile dysfunction and make sure that none of those are contributing to it, because those are usually the easiest ways to see results, is to make sure those things are under control first. And then depending on the patient, whether it be oral medications, vacuum devices, or invasive procedures, those are usually the first three, but most men tend to go for oral medications first. And then if none of those are working, then it would be to maybe consider penile prosthesis. But during this entire time, patients should be checking in with their physicians. There should be an open dialogue because it is a very sensitive and private matter. And so it's always important to have that open discussion with physicians to see what the patient is comfortable with and treat each patient individually, because there isn't an exact reason why patients might have ED. It can be a contribution of multiple things. So it's very important that there's specific conversations going on for each patient to help them get the satisfaction that they're looking for. If you guys have any questions, feel free to ask me. Bye.